The coupled yang organ is the urinary bladder. The function of the urinary bladder is to hold and to eliminate urine. It should be able to eliminate on cue when it is full and should hold the urine when not full or when the toilet is not available. So let's talk about urinary bladder in stagnation. We have a full bladder with difficulty starting to pass urine, weak flow, and some amount left in the bladder at the end. There is also increased night urination. Then the next, we have the urinary bladder Qi deficiency. There is dribbling or stress incontinence, increased night urination. Thirdly, we have urinary bladder hyperactivity. There is frequent and urgent urination in small quantities, and this could mean cystitis, or may occur when a person is nervous, may have dysuria with blood or pus. And we have the urinary bladder yin and qi deficiency. There is frequent and urgent urination, whereas with cold weather or when nervous, there is also dribbling or stress incontinence. Treatment for urinary bladder damp cold stagnation. We use the points bladder 28 and 32, needle and cupping, 10 minutes of each point. These are the back shoe of the bladder and the local point. Cupping promotes emptying of the fluid from internal organs. Then we do REN3, moxa, and stomach 29. These are local points. Spleen 6, the area distal point. Then we use the bladder 58, luo point, which sedates the yin and tonifies the yang. Stomach 40, of course, to circulate dampness. Li4, the great eliminator, to help the urinary bladder empty completely. Next, treatment for urinary bladder Qi deficiency. Urinary bladder 28, urinary bladder 32. These are back shoe and additional local point for the urinary bladder. Then we do REN3 moxa, the front mu and local point for urinary bladder. This will tonify the yang with moxa. Then we use the tonification point, bladder 67, and kidney 3, which is an earth point to tonify kidney yang. And of course, we have spleen 6, the area distal point. Hyperactive yang in urinary bladder. This describes the symptoms of damp heat in the urinary bladder. REN3, the front mu point of the bladder, cools and calms. We also use spleen 6, the area distal point, and of course, kidney 4, the luo point, with bladder 64 sedation, which is a yuan source point. Tonifies yin and sedates the yang. Bladder 28, bleeding cup, and this will eliminate harmful heat with bleeding. Do 20, tranquilizing point. Bladder 63, she cleft, or bladder 65, sedation point, sedation. Keep sipping water and rest well. After recurrent or prolonged urinary tract infection, the harmful heat of the inflammation may inhibit the healthy functional qi of the urinary bladder. Then it is possible that the urinary bladder does not empty well and there is some amount retained in it. The picture looks like this. So let's look at the tower diagram for harmful heat that inhibits the functional qi, which means that there is inflammation. In this case, the treatment should be to eliminate the heat and to improve the function. So we do bleeding cup on tender points at bladder 28, which is the back shoe of the urinary bladder. Bleeding eliminates the heat without affecting the qi. REN3, the front mu point of the bladder. Spleen 6, distal point. Bladder 58, luo point. This sedates the yin and tonifies the yang, increasing the efficiency of elimination of urine. Li4, great eliminator, also will help elimination improve. Now, let's talk about urinary bladder yin and yang or Qi deficiency. This is a chronic state with deficiency of both. And since neither can control the other, in yang situations, the yang will dominate, causing frequency and urgency. And in yin situations, the yin will dominate, causing night urination, dribbling, and incontinence. Treatment: REN3 and bladder 2832. Mild moxa can be used not to make the skin red. Kidney 7 and bladder 67, these are tonification points. These may make the frequency worse at the beginning because of the extra energy that flows in, but this would soon settle down. The initial sessions can be once weekly to avoid this complication, and once the patient is better, treatment could be given twice a week. Many books describe symptoms of cystitis as damp heat in the urinary bladder. This may be due to the fact that there is often a slippery pulse quality on the water urinary bladder pulse position. The urine is colored and turbid, may be with some blood cells and pus, showing that there is stagnation of fluid here. But as long as there is frequent and little quantities of urine each time, with no sign of any remaining urine in the bladder, the picture is of a yin deficiency. Spleen 6, distal point, and Li4 to help elimination. In all cases of urination problems, it is important to avoid caffeinated drinks that irritate the bladder and to keep the lower abdomen and the feet warm with suitable clothes and footwear. The urinary bladder associates directly with the uterus and the prostate gland. These organs lie over each other and are influenced directly by treating the UB meridian. We have all heard about the turning of a breech baby in late pregnancy using the point bladder 67 moxa. Now let's talk about turning a breech baby in late pregnancy. The best time to do this maneuver is between the 28th and 32nd week of pregnancy, week 28 to 32. The 34th week is the latest. It may be true that left without treatment, the baby may turn after this time, but it is perfectly safe for this to happen with our treatment as well. If the baby moves into the head presentation position after 34 weeks, it might be impossible for the head to engage in the pelvis because it is too large. So it is not an effective treatment for working towards a normal childbirth. The mother-to-be ends up with a cesarean section anyway. Treatment. The mother-to-be lies in a semi-reclining position on the bed with clothes loose around the abdomen. The therapist sits at the foot of the patient with a lit-up moxa cigar. Point bladder 67 is used on one foot with sparrow pecking movement of the moxa cigar. The patient should tell you when the heat is uncomfortable. When it is, then the other foot, bladder 67, should be warmed. When that feels too warm, you should go back to the first foot again. Alternate between both feet for 6 to 10 minutes, depending on how soon the patient feels the heat. The treatment should be given daily for 3 to 5 days, and every day beginning the treatment after checking the baby's position. Treatment must stop when head presentation is noted. The mother-to-be will notice increased contractions and baby movements during and after the treatment. This is quite safe. If there are increased contractions of the uterus at any time, either in dysmenorrhea or in pregnancy, this could be calmed by sedating bladder 65, the sedation point. We have already talked about habitual miscarriage and uterine fibroids. Prostate hypertrophy and prostatitis have also been discussed. Remember that each time we tonify the urinary bladder yang, we inadvertently tonify also the kidney yang. And when we sedate urinary bladder yang, the kidney yang is also sedated. Now, there's a question if we can cause contraception through acupuncture. We are wary of causing this energy state permanently, but tonifying, using the tonifying point, bladder 67, on the morning after is a good precaution. So there was one young woman who decided to try this out, and she developed bad kidney colic afterwards and passed 2 small stones.